Every day, thousands of patients walk into clinics with a clear goal: to regain their mobility. Yet, when they finally sit on the edge of the therapy table, staring at a resistance band, they freeze. They stop short of the exact exercises required to heal them. It is easy to label this as a lack of willpower or a bad attitude. However, clinical data suggests that the refusal to engage in therapy often has very little to do with a patient's desire to get better. These patients are caught in an invisible psychological friction. Their brain is weighing the appeal of short-term comfort against the long-term necessity of mobility. And in the heat of the moment, those two priorities are in direct conflict. We must look at what happens inside the mind at that precise moment of hesitation. What forces are active when a patient chooses to stay still? Successful recovery involves a physiological process and a mental one. It is a constant negotiation over how we perceive time and how we process discomfort. When the brain weighs present pain against future freedom, it defaults to specific, measurable cognitive biases. The first mechanism is status quo bias. The brain anchors itself to established routines because they feel safe. Any deviation from our current state, even a healthy one, is registered by the mind as a potential risk. In a clinical setting, this means the brain perceives resting as the safest default. Pushing through a difficult stretch breaks that status quo. Consequently, the mind signals that staying immobile is the logical choice, even though that immobility prevents physical progress. This creates a powerful illusion. To the patient, doing nothing today seems like the easier and more secure path. The brain views inaction as a protective measure against immediate threat, rather than a failure of willpower. While the status quo keeps us anchored, a second mechanism actively distorts how we view the timeline of our own recovery. Hyperbolic discounting is a temporal glitch where the brain fails to accurately weigh future outcomes against present experiences. This chart shows how the glitch works. Skipping an exercise provides immediate relief, so the brain magnifies its value, spiking aggressively in the present. Simultaneously, it shrinks the future reward. Full mobility is months away, feeling insignificant compared to immediate comfort. Choosing immediate relief repeatedly creates a zone of non-compliance. Over time, these choices stack up, leading to chronic immobility. This calculation happens so quickly that a skipped exercise feels like a valid personal preference. The brain is effectively hiding the clinical danger from the patient. This cognitive glitch leads the brain to sabotage the body, stalling the recovery process and keeping the patient stuck in their current limitations. To counter an invisible future and a heavy present, we can bridge the gap by making future outcomes visible in the present moment. This is where Torbay charts come in. They are a structured visualization tool designed to fix the brain's skewed perception of time. These charts map how actions today change tomorrow. By looking at a single node today, patients see two different futures. When seeing how a skipped session widens the gap to recovery, abstract consequences become undeniable data, forcing the brain to reevaluate the trade-off. Torbay charts provide a way to neutralize the brain's temporal glitch by turning an invisible future into concrete, immediate information. Once the future is visible, the psychological friction eases. Hesitation is replaced by a renewed commitment to the physical work required. Effective medical compliance is about more than enduring pain. It is about providing the clarity a patient needs to see their own progress accurately. Dismantling these hidden cognitive biases restores true patient agency. Recovery becomes a deliberate, empowered choice rather than a prescribed chore.